Hello, my name is Rob Fraser. I'm a registered nurse in Toronto, Canada, and I work at a company called Swift Medical, a digital technology company focused on wound care management. But I'm also a nurse at a youth homeless shelter working in primary care, mental health, and addictions. And I'm really excited to be talking to you today about addressing mental health using technology as a really important part of inclusion. And mental health is something that everyone has to deal with. Just like our physical health. We all can say, today I feel strong, today I feel sick, and we know this kind of concept of physical health. Mental health is something that we all also engage in, but there's also something called mental illness, and these things play a big impact on how we participate in education and are a big part of inclusion. So let's talk a little bit about mental illness. Mental illness is alterations in the way that you think, your mood, and your behaviors. These can be noticed in the way that you express yourself. When people look down, you can tell that they're sad. When people are really excited or agitated, you can see their behaviors shift and change. Where change in thinking and mood and behavior become an illness is when it becomes so distressing. Your mood is such a problem, your behavior is such a problem that it impairs your function, your ability to actually participate in your daily work or school or daily life. So that's what we think about when we talk about mental illness, and this is something that's very common. We know that 1 in 5 people in Canada will experience mental illness in their lifetime. And mental illness can be something that's short-term, just like you can get sick with the flu and you're sick for a few days, but then it goes away. You can have something like, for example, depression that's temporary. After a few months, perhaps what's going on in your life changes, or there's interventions that change how you feel, so that depression goes away. Other people experience mood disorders that are lifelong and persist, like a chronic illness, just like diabetes. So there's a real range in mental illness and how these can be experienced and how they affect one's ability to participate in school. So during a pandemic, for example, we know that people are experiencing more anxiety because there's uncertainty in their future. The daily life circumstances are changing regularly. So these are things that we're aware of that are impacting people's mental illness. Now, mental health. That can be thought of more as our resilience, our ability to adapt and adjust to the stresses that come. So when I think about school, I remember back to my days going through and having exams, and that was a really stressful time in my life. But that was a stress that I had the resilience or the ability to respond to, the ability to manage and adapt to. And people can go through all sorts of difficult life circumstances, whether it's family breakup, losing a job, unstable housing. And their mental health can play a big part in the ability to cope with that. And by focusing on people's mental health, we can improve their ability to manage and go through stress without becoming ill. So remember, becoming ill is when you can no longer cope with it, or the stresses and the changes in the way that people are thinking, behaving, and their mood are so distressing that it's affecting their daily life. So mental health is a big thing that we can all work on, regardless of whether you're experiencing mental illness or not. And these are two really important concepts to education, especially as we continue to have a evolving kind of life circumstance where we're not too sure where our social interactions are going to be. Because you can see in this definition, for example, our ability to see our friends, to see our family. Those are things that help us be more resilient and adaptive to change. So during uncertain times, mental health becomes even more of a focus. And so I put this graph up because mental health and mental illness aren't a static point in time. They're not something like someone's weight, for example, that you can step on a scale and you can complete it once and then we know where you're at. In mental health, there are things such as mood disorder rating systems, so you can get someone to assess, are they depressed, are they anxious, but that's just a one snapshot in time. It changes as life goes on. And people may have things in their life that are pushing them up. So for example, supportive friends, supportive families. So those things are really good for one's mental health. And other things that are pushing them down, perhaps a fight with a significant other, a bad test score. So it's a complex intermix of factors that are going on in people's lives. And so when you're thinking about inclusion and working on addressing mental health, in this Convergence Technology Challenge, you can really think about the different factors and not necessarily trying to address everything, but what are the different things that are happening currently in people's lives that you're interested in tackling and adjusting. And is it one point in this graph that you're looking at, for example, how the pandemic is changing people's anxiety, or is it more specific to mood disorders or things that are kind of lifelong persistent bars in someone's life that are impacting them? And so thinking about focus, this is a really big kind of piece of addressing mental health. Mental health is a really, really big topic area. So there's different ends of the spectrum that you can think about, and there's illness and wellness. And so illness, again, being about when people are sick, when they're struggling, when they might need medications, when they might not be able to participate in school. Wellness is more about building continued capacity. So doing mindfulness and meditation just to cope with everyday stress, just to make sure that people are happy and well, and it's not necessarily focused on that illness. And then even in illness, you have kind of the periods of wellness, and you have periods of acute exacerbation where things get worse. So where do you really want to focus in this? Because it's very difficult to address everything. So how are you working in your teams going to pick specific places to look at, whether it's autism's impact on people's ability to participate in school, and the impact of depression, and things related to mood disorders. Like, there's a wide range of things that you could look at. So I really encourage you to dig in and focus in one particular area that you want to make a difference. Then we think about, who do you want to focus on? So as a nurse working at Covenant House, I think a lot about the who. And unfortunately, the clients that I work with, we can't guarantee that they have a supportive sibling or a supportive family that's going to be the person that can help them through this difficult period. So in making your solutions and designing them, you can think about who is actually going to be giving them help. Is it going to be coming from a teacher in someone's life that can support them with more advanced resources or understanding of how to cope with mental illness? Is it the person who's actually going through the illness, or that you want to improve their wellness, the actual target? Is it the parent who's looking to support better their kids who are dealing with mental illness? Is it for peers, because peers are having to recognize the fact that their friends are going through anxiety, and they might need supports in helping to navigate that situation? So there's a lot of different ways that you can come at mental health and illness, and it's not just directly at the one individual who's experiencing that illness or that challenge. There's a whole network around people, and you have to think specifically about who you want to leverage in the solution in order to make an impact on that person. Then I really think about engagement. What's the plan? What's the kind of adoption? So I work at Swift Medical, and so we're a company that does wound management, and it's a technology that you use your smartphone, and it works really well. But we have to think about, what's the plan for engaging people to use it. And it's actually kind of neat. I think back to a hackathon that I participated in more than 5 years ago, and from that led to a company that I'm now working for. So these tools can have real potential for change, but in order to have any change, you need to think about user adoption. And so, for example, in my work, I have to think about, maybe not all nurses are comfortable taking photographs. They didn't grow up using Instagram, because the average age of a nurse is much into their late 30s and 40s. So how do we teach them to take really good wound images? How do we get them to comfortably navigate technology? So what's the learning that you're going to have to do? Because it's not just a technology solution you want to develop training about how to actually use it and leverage it. So going back to the users, if you're getting teachers to use it, how are you going to train them to actually use a solution so that they can be effective with what you've actually created? And this is a really big part of success, is thinking not just about this, your eureka moment of, oh, I have a really good idea and it's going to work well. There's really a big kind of what we call the adoption cycle hump that you have to get over, and that is best thought through by working on your adoption strategy, your advertising or your training materials, how you design the app to be user-friendly and to teach people. So really thinking about whatever you create and how it's going to be actually adopted by those users. Next is barriers. Barriers are something that we often don't think about, because it's, oh, this great new technology, the internet's going to solve every single problem. We just need to get a website about mental health, and then people will have access to it. Well, when we think about that, we actually know that there's a lot of rural communities, people who live in the country, people who live in isolated parts that don't have good access to the internet, that don't have smartphone technology. So that actually doesn't work for them. I work at a youth homeless shelter, and so not every youth actually has a smartphone. Often they get stolen, they get lost, they get broken, they don't have data connections. So who are you trying to target? And then take some time to really think through what are the specific barriers that that individual is going to face. Do they have depression? Depression is going to make them less motivated to participate in something. So then how do you then respond and create a really engaging tool or something that takes very little effort to engage in so that someone facing depression could engage? Or if you look at autism or someone with a learning developmental delay, how do you think about the ways that you make it simple for that person with that delay or that different way of learning to engage in the tool? Because you can't just create a tool and assume that users are going to come and adopt it. So a big part of addressing this is thinking through what are those specific barriers that my users are going to be facing that I can address and overcome in order to help them achieve those the goals that I have set out for them. And then metrics or measurements. How do you actually measure success? Is it going to be visitors to your website, reading content? Is it them looking at videos? Is it them completing a survey on their mood every day, and then they would see how their mood improves because they've been doing the exercises that you've been giving them for mindfulness, or the different training that you've been giving them to cope with a low mood? What are the ways that you're going to be able to look at that and tell that this is being effective so that you can share your story and show people that it's working so that there'll be further adoption? Or if there's not an uptake in it and you don't see people viewing your videos, then you come up with strategies about how do I engage people. Maybe we haven't been posting to the right websites or advertising in the right spaces. Maybe the group that we thought would use it isn't the actual target market because we know that the data is showing us something else. So thinking about what you're going to collect and show from creating these solutions to understand how you're having that impact and making changes and adapting them. Because if you don't have data, it's very difficult to make a case for growing support to get more people to start to use the app, to give you more resources to continue to fund the app, and then also to give you the insights on how to change and adapt your app to make it better. So these are my kind of thoughts as a nurse who's really passionate about technology and really passionate about mental health. There's a lot of challenges out there that I think are really worthy of taking on in the space of mental health. They can have a big impact on people's ability to take part in education, to take better part in their kind of daily social activities in their lives. And I wish you so much luck in this event and taking part. And I hope you decide to take on a challenge related to mental health and come up with new, unique ways of solving it, because we could all really use that support and change and helping people to participate. And as a healthcare provider, I'm always so excited when people with different backgrounds are coming in and looking at ways that we can do things differently and with skills that we need in healthcare to address these challenges. So I hope you have a great time doing this exercise, and I really look forward to the results that are going to come out of this event.